The 2025 ASE guidelines have a new algorithm for estimating left ventricular filling pressures. I'm Sherif Nagueh, the Medical Director of the Echocardiography Laboratory at Methodist DeBakey Heart and Vascular Center in Houston, Texas. The new algorithm recommended in the 2025 guidelines is primarily aimed at increasing the feasibility of using echocardiography to estimate left ventricular filling pressure and also to keep good accuracy. In previous iterations, there was a high rate of indeterminate cases, meaning they look at it and they cannot determine what left atrial pressure. This is almost completely eliminated with the 2025 guidelines, and we also have a higher accuracy compared to previous iterations from 2016. I see this algorithm of interest to general cardiologists, and in addition, it is of specific value to physicians who read echocardiograms, as well as physicians who see and treat patients with heart failure. So it's an approach that is in part done to increase the feasibility of using echocardiography and avoid calls where the reader cannot determine what the pressure is. We rely on variables at first, in a first step, that have a high feasibility and have high reproducibility. In a second step, if the first group of variables are incomplete or are inconclusive, we look at 4 additional variables. And finally, if these are also not conclusive or incomplete, we have a third set of variables. We call them supplementary methods that may be utilized. I want to emphasize the importance of a complete protocol that allows for the acquisition of all variables, a close scrutiny by sonographers and physicians regarding the quality of the data that is gathered, and thirdly, to look carefully at the clinical situation and determine whether there are reasons why some variables may have less validity or less importance. ASE has had specific webinars to guide physicians on how to go through the algorithm and navigate it. There is also an app in work, so that may be used to go through the algorithm and arrive at a conclusion regarding left ventricular filling pressure. In addition to the webinars and the apps, please feel free to communicate with me about specific cases or questions that you have regarding the algorithm and its application.